Do you have a deformed or misaligned big toe? You probably have a bunion deformity. Hi, my name is Rina Harris. I'm a functional podiatrist, and in this video, we're going to explore what bunions are, what causes them, and how to improve them. Bunion is deformity of the big toe joint, whereby the first metatarsal deviates away from the second, and the hallux, or the big toe, deviates towards the lesser toes. There's a common misconception that bunions are hereditary in nature, but no one comes out of the womb with bunions. We now know that one of the leading causes of bunion deformities are poor footwear, narrow toe box shoes. The other causes of bunion deformities are also weak intrinsic foot muscles. This muscle here, the abductor hallucis muscle, as you can see, it's on the inside of the arch, it supports the arch, but also is responsible for a straight big toe. And now I'm going to show you 3 great exercises to help improve big toe alignment, restore function, and reduce further progression. For this first exercise, you're going to need a band like this. So grab a band, double it, and place it around your big toes. Place some tension on the band so it helps to straighten the toes. Then from here, make sure your feet are parallel. Bend the knees a little bit and lift the toes as high as you can. When you're up here, send a message to your toes to spread and splay. And then reach them forward ever so slightly and give them a little press, a squeeze. So let's do that again. Lift, spread, reach forward and press. This is a great exercise to mobilize the big toe and improve alignment. Now we're going to move to the second exercise. For this exercise, we're still going to use the same band, and you can do this seated or standing or kneeling. So grab the band, place it around just the big toe, and place some tension to make sure the toe is straight. I'm going to stand for this. You're going to place the other foot on top of the band to hold it in that position. Now from here, lift all the toes up as high as you can, and then we're going to tap the big toe into the ground, and then we're going to come up again. So again, I don't want up and down like this. Make it more active by pressing the toe into the ground, activating the abductor hallucis muscle, which is the muscle responsible for a straight big toe. So I advise to do this drill for a minute, 2 sets. So for this exercise, you're going to need a band like this. So grab it, double it, and place it across the ball of the foot, your forefoot. Now come to a slight split stance position, and from here, you can see my foot is up towards the ceiling, the toes are lifted up, and this movement is all about twisting the forefoot down. So we're twisting the forefoot. The aim is to drop the head of the metatarsal down towards the floor. Then we're going to come to a start position, and we're going to do that again. Down and up. Now this can be quite a challenging exercise. It's more of a kind of brain exercise really, but it's a really good one to strengthen the peroneal longus muscle, which is a really important structure when we're treating bunion deformity. And my advice is to do this for about a minute, 2 sets. I hope you found these tips useful. Please remember, if you have bunion deformity, you do need foot-shaped shoes with a wide toe box. If you're suffering with bunions and you would like more information and tips, we have a comprehensive in-depth course on our VivoHealth platform, so go and check it out. And if you have any other issues with your feet, such as flat feet or plantar fasciitis, check out these videos. Thank you for watching. See you again.